Good day. My name is Dr. Mansour Ramalan, and I'm here to talk to you about thyroid fine needle aspiration. Thyroid fine needle aspiration is a procedure that is conducted on a patient with a thyroid nodule, and usually it is done for some purposes to detect thyroid cancer and also to grade the type of thyroid lesion so that one can plan the management strategy for the patient. It can also be used for thyroid cyst aspiration. Once we identify the cyst, you can aspirate the cyst and the patient goes on fine. It is a procedure that is simple and can be conducted in a doctor's office. Does not require so much sophisticated equipment and materials. So if it is conducted appropriately, it has the capacity to detect, it has a false negative value of about 5%, meaning that 5 in every 100 patients with a positive cancer may actually not have a cancer. So 95% of patients with cancer will certainly have a thyroid cancer. Usually the procedure, we have to talk to the patient, obtain his consent, and explain the procedure for the patient. And once we're able to obtain the consent and talk to the patient about the procedure, telling him about possible complications that can occur, like bleeding, pain, rupture or destruction of other organs or structures that are around the neck. Because we know the thyroid gland is located in front of the neck, care is taken not to damage structures that are around the neck. Sometimes an ultrasound scan may be required because the gland may not be appropriately visible, so we may need to use an assistance of an ultrasound scan so that we can locate the gland. Once we palpate, once the appropriate consent has been obtained from the patient, the patient is asked to lie supine on the bed, lying flat, and then the neck is a little bit extended. We use a fine core needle, which is usually smaller than the needles we used to know. We have to clean the area of the neck where we want to take the biopsy using a local anesthetic agent. Once the area of the neck is clean, we use the needle to take a core of tissue in about 46 different places around the nodule. And once we obtain the sample from the needle, we quickly apply some pressure and to stop the bleeding from the neck and to clean the neck, and the patient is allowed to rest for some few minutes. The sample that is taken from the thyroid aspirate is being it will now be sent to the histology laboratory for processing, where it will be made into a smear in a glass slide. Once it is smeared into the glass slide and prepared, it will now be viewed by the pathologist and the report sent to the doctor for possible interpretation. After the procedure, the patient may experience some slight pain around the neck or the area of the procedure. Sometimes the thyroid gland may not be visible enough and you may not be able to get appropriate amount of tissue. And in some cases, the lesion may just be cystic, and so all you need to do is to just remove the fluid inside the cyst using the needle. An ultrasound guide may also help to get the fluid from the neck. Once that is done, the patient is home and dry, and you will wait for some minutes in the office before once he's stable and he's fine, he can go home on his own. There's not much complications related to the procedure. It's a simple procedure that can be conducted anywhere, even in the office. Does not require sophisticated equipment, does not require so much technical expertise, and it doesn't take time. takes about 15 to 20 minutes and all day it's over. So I hope with this video you've been able to learn a little about fine needle aspiration and also some of the indications and probably a little of the complications that may arise. Thank you.